Hello everyone. I am Dr. Vijay Rao, consultant rheumatologist at Divisha Arthritis and Medical Center, Basveshwanagar, Bengaluru. I would like to uh, enlighten my patients or who are watching this video about what Divisha Arthritis and Medical Center is about, what a rheumatologist is about, and what are autoimmune disease about. So, to start with, first I would like to let you know about what is autoimmunity. Autoimmunity is immune system in the blood which is supposed to protect us. They are like our defense forces. So, that is actually meant to protect us from all external attack and external attack, and then uh, giving us protection from infections and also protection from various diseases. But in autoimmune diseases, the immune cells become our enemy and start attacking us. It's like Indian soldiers attacking India. So it can affect various organs of the body, not only joints. It can affect brain, eyes, hair, skin, glands, lungs, heart, and then bones, joints, blood, and kidney. So this we categorize into mild, moderate, and severe. If skin and joints, skin and hair only affected, it's categorized as mild. Skin, joints, blood are affected, we categorize as moderate, and if it's internal organs such as lungs, kidney, and brain are affected, we categorize as severe. So there are several autoimmune diseases, of which commonest is rheumatoid arthritis. Then there is SLE or lupus. Then there is vasculitis. Then there is ankylosing spondylitis. Then there is psoriatic arthritis, and there is several other of them. It affects various age groups, from uh, youngest patient being children or adolescents, and oldest patients being above 65 years. So the myth that arthritis affects only aged people is actually wrong. Most of the autoimmune diseases affect between the age of 15 to 45 years age group. So it affects both genders, males and females, although rheumatoid arthritis is more common in females and ankylosing spondylitis is more common in males. It can affect even kids. So, youngest patient can be as young as even 5 years to 7 years, or between even adolescents between 18 to 20 years. So, the myth about that only certain sections or gender can affect it is actually wrong. It can affect even pregnant women. One of the most common causes of pregnancy loss can be autoimmune diseases. So, who treats autoimmune diseases? It's a rheumatologist who treats, who has a special super specialty training in treating autoimmune diseases. After doing MBBS, we spend around 3 to 4 years in general internal medicine, and then another 4 to 5 years in rheumatology with treating autoimmune rheumatic diseases, and subspecialty like what I have done in United Kingdom, where treating certain sections of autoimmune disease like lupus. I have special interest in lupus and rheumatic diseases in pregnancy. So, autoimmune diseases are better treated by rheumatologists because we not only have in-depth knowledge of immune system, we also have knowledge about side effects of these medicines, how to manage with complications of these diseases, and so on and so forth. Now, to let you know about myself, I am Dr. Vijay Rao. I graduated from Bangalore Medical College. Then I went to United Kingdom to do my internship and further general internal medicine, where I rotated through various branches of medicine and selected rheumatology because it affects several organs of the body, and most of these diseases, if not treated well, can lead to devastating complications in main bread earners of the family. So I worked with one of the world-renowned professors in rheumatology, such as Professor Paul Emery in Leeds and Professor Caroline Gordon in Birmingham, who is one of the world authorities in lupus and runs the Lupus Center of Excellence in Birmingham. and also Professor Simon Bowman, who is one of the leads in Sjogren's syndrome, which is one of the autoimmune diseases. So these are the centers where some of the cutting edge research have been done, and involved in several drug trials and researches, and also contributed to several of the textbook chapters and publications in rheumatology. So after coming back to India, I have been associated with Manipal Hospital for the last 8 years, and Divisha is my own one-stop solution for autoimmune diseases. I've been running for the last 4 years. Now I'm a full-time consultant here, where we are open from morning 9 a.m. till evening 9 p.m. Monday to Saturday. We have a dedicated rheumatologist, which is me, full-time running here, seeing autoimmune diseases, and we have a phlebotomy service where we do all autoimmune service tests, and we have a dedicated pharmacy where we subsidize treatments, because most of these treatments are lifelong, including some of the costly expensive medicines such as biological agents. We offer more than 50% discount to patients. And we have a dedicated daycare service for running injections such as monoclonal antibodies, cyclophosphamide, endoxan, solimedrol infusions, and with a dedicated, fully experienced rheumatology nurse. And we have physiotherapy for all our autoimmune diseases, for muscle strengthening, stretching, and therapeutic yoga services also. This is one-stop solution for making all autoimmune disease patients better. So, having told about autoimmune diseases, having told about rheumatologists, having told about myself, what I would like to tell is autoimmune diseases are definitely can be controlled with early diagnosis. Correct treatment, lifelong treatment may not be required if treated early within 45 days of window period. So most of these diseases can be totally controlled within 3 months, and 3 to 6 months we stabilize the treatment, and from six months onwards we gradually start reducing the treatment. And once we reduce the treatment, we see patient to patient improvement, and if patient is doing very well, then we slowly reduce the treatment and gradually stop it. Now, if after reducing treatment disease gets worse, then of course we do not stop the treatment, we maintain it at a very low dose. All these treatments are extremely safe, they do not cause any side effects, and we don't rely on steroids as rheumatologists. We use several steroid sparing agents, and we don't use heavy painkillers. These treatments are safe in pregnancy and can be used very well in pregnancy without causing any side effects to baby or mother. With that in background, I would like to conclude this video by telling that most rheumatological diseases get better only if you have faith. So you have to have faith in yourself, faith in the doctor you're seeing, and faith in God. So I often tell this to patients that it's a teamwork, with the main player being the patient and the supporting player being the doctor, that is me, and the umpire being the God or faith. So with that statement, I would like to say that you would do very well with all your autoimmune diseases if you take timely treatment without any major side effects, and hopefully you'll get cured from all your diseases. Thank you very much. God bless you. Hello everyone, I am Dr. Vijay Rao, consultant rheumatologist at Divisha Arthritis and Medical Center, Basveshnagar, Bengaluru. Today I am going to talk to you about a very important disease called SLE or lupus. SLE stands for systemic lupus erythematosus, which affects various parts of the body, not only joints. It's an autoimmune disease very commonly seen in ladies, that is from menarche at this time of puberty till menopause. I often call lupus SLE as a fire. So for fire you need wood, kerosene and matchstick or lighter. Wood are your genes, kerosene are your female hormones. That is why more commonly seen in three important crucial stages of a lady's life, that is puberty when the periods start, or pregnancy when you get pregnant or deliver and start breastfeeding, or menopause when you stop having periods. And these changes, hormonal fluctuations, or the kerosene comes on the dried wood, which is your genes, and exposure to sunlight acts as a trigger, that is the matchstick or the lighter, causing the fire, which is the lupus fire. So, which in this, the immune cells in your blood becomes your own enemy and starts attacking skin, hair, glands, joints, blood, internal organs such as lining of the lung called pleura, sometimes inside of the lung also causing bleeding or lung hemorrhage, and affecting the heart valves, causing the fluid around the heart called pericardial effusion, and causing blood problems such as low hemoglobin, low white count, which fights your infection, and low platelets, which causes bleeding problems, and can in severe cases can affect brain, causing fits or seizures or strokes or severe headaches, or causing kidney problems such as protein leak in the kidneys, and also causing what we call as proteinuria or swelling or filtering capacity of the blood. Kidneys get affected, and in severe stages can lead to dialysis dependence. Lupus can affect uh, various age groups, as I told, but 9 times more common in females. It can affect pregnancies, causing repeated abortions, problem conceiving if the disease is very high. If the disease is controlled, conception is not a problem, but maintaining conception is a problem. So we check something called as raw antibodies, which is normally done in an ANA profile test. And these raw antibodies in 1 in 100 women can, that is 1%, can cause the placenta, which is in your reproductive, in your uterus, and can affect baby's heart, cutting the electrical wires in the baby's heart, causing heart block, needing pacemaker. So lupus patients who have raw antibodies need something called as fetal echo from 4th month of pregnancy, that is 16 weeks till delivery. So if adequately treated, patients can lead a normal life, can achieve normal pregnancy, provided treatments are not stopped. Treatments take about 3 months to work. They gradually work, and we normally expect patients to achieve full control 6 months before pregnancy, and after that, there's not a problem. There are several treatments such as sulfasalazine, azathioprine, which are very safe, and even tacrolimus in pregnancy. They can be used in pregnancy and breastfeeding, and we don't suddenly stop treatment in pregnancy. They're safe in breastfeeding and lactation. And steroids we use very less in pregnancy, and if used less than 7.5 mg, it is very safe. One of the complication we usually take care is preeclampsia, so we use aspirin in pregnancy. And there is one condition called antiphospholipid antibody syndrome, or APLA or APS, which is seen in 50% of lupus patients, which makes the blood thicker in pregnancy, and thick blood does not flow to your baby through a tube called umbilical cord. So we normally thin these patients who have antiphospholipids such as lupus anticoagulant, anticardiolipin, beta 2 GP glycoprotein antibody, which is done in blood tests. So in these patients we thin the blood using heparin injection, which is safe in pregnancy, can be continued throughout. So in lupus, we usually diagnose by doing a test called antinuclear antibody, or ANA test, which is best done by immunofluorescence test, which we do here in Divisha, and seen in 99% of patients with lupus. So if you have fever, weight loss, loss of appetite, sun-induced skin rashes, mouth ulcers, hair loss, severe fatigue, joint pains, pain, stiffness first thing in the morning, then we do this ANA test, and if pretest probability is very high, that is if these symptoms are indicated, then this test is fairly very sensitive, able to pick up lupus in 99% of patients. And we do ANA profile tests in women going for pregnancy, or if we suspect any lung disease where we want to see RNP antibody test. And we do antiphospholipid antibody tests if patients present with strokes or heart attacks, to check if there are blood clots problem, or even if patients want to go for pregnancy to see if there is any pregnancy loss problems. So, if a urine test we do to see if there are no kidney problems in these patients, and once the tests are done, we start the patients on tablets such as tacrolimus, mycophenolate, azathioprine, which takes about 3 months to control. From 3 to 6 months we stabilize, and 6 months onwards we gradually reduce treatment. Takes about 5 years for completely stop treatment, and step by step we reduce treatment. It is able to stop, continue, it's able to gradually reduce treatment, but we maintain on hydroxychloroquine or HCQ, which aims to control your lupus very well and prevents it from getting flare up time to time. So as this picture shows, this lady has a malar rash and antibody tests, and the kidney getting affected and the immune complexes in the skin. So this slide shows that it can affect various parts of the body, and it's important that you see a rheumatologist and able to lead a normal life with adequate control, avoid sun exposure using sunscreen lotion, avoid red meat consumption, and then avoid saturated fats and refined sugars and excessive rice quantities. So with adequate treatment you will be able to lead a normal life, and all these pictures showing various parts of the skin, lung, and heart getting affected in this disease. So with adequate treatment you can lead a normal life with no problems. I wish you all the very best, and believe in yourself, take correct treatment, believe in your rheumatologist, most importantly believe in God. Thank you very much.